And welcome back to the Dr. Anonymous Show, live here on Blog Talk Radio. Just a big heads up to people in the chat room here after our brief show here this evening. I will be having a post show over on my Ustream site, dranonymous.tv, and I'll be able to catch everybody up on what I've been doing for the past couple of weeks since I haven't had a show. But for right now, we're going to talk about autism. Autism Awareness Month here in April. And I invite people after the show, maybe not exactly right now, but you can go to dranonymous.com and you can see a 3-minute TV interview I did at the beginning of this week talking about autism awareness. I'll be sharing a little bit more detail about some of the things. So I encourage you to check that out. Autism spectrum disorders. They're a group of developmental disorders that cause lifelong difficulties with socializing, communicating, and behavior. Very, very confusing set of diagnosis. And the reason that they use spectrum, because usually with a disease, and this is very confusing, but usually with a disease, if you look it up on WebMD or, another reputable internet site, they say, hey, these are the symptoms. Like if you have pneumonia, you usually have a cough and a fever and sometimes shortness of breath. But autism is very more vague than that, and they use the word spectrum. And the word spectrum, it refers to the fact that some people have a few mild symptoms and others have more severe symptoms that are disabling. And they use a lot of different terms which can be very confusing. They use autistic disorder and other terminology is early infantile autism, childhood autism. And other terms that they use include Asperger's disorder or Asperger's syndrome, or the complicated term called pervasive developmental disorder or PDD, NOS, not otherwise specified. All of these are on the autism spectrum. And the reason why there's a lot of different names is because the people who are diagnosed with this, they can have varying degrees of severity of symptoms, and that's why it's very confusing for people, especially people who don't know or who don't have a family member affected with one of these spectrum disorders. Now, how common is it? We have seen an increase of this since the 1970s, particularly in the 1990s and the late 1990s. And why is that? Well, we don't know why that is. There are some theories behind that, and I'll get into that in a little bit. We don't know what the cause of it is. We're still trying to figure that out. There's a lot of people who have theories about that. They want to blame a lot of different things. But before we get into that, I do want to talk about some of the symptoms of this. And some of them are what they're more classically what you would see. And some of them are more subtle. One of the key things is social interaction or difficulty or lack of interaction with family members and friends. This is the hallmark of autism spectrum disorder. And components of this, parts of this, have to do with, nonverbal behaviors, lack of eye contact, certain facial expressions, difficulty using and interpreting nonverbal behaviors like eye contact and facial expression and gestures, difficulty relating with peers, with other children, and sometimes they may not even feel an interest in developing relationships with their peers. Usually with kids, they want to play with other kids. And typically, kids on the spectrum would want to stay by themselves, on their own, without any kind of interaction with anybody else. Another thing that is very difficult is communication. A difficulty with communication. And this is obviously where parents become very concerned about that, because sometimes there may be a language delay and sometimes not. But it is this lack of communicating, which usually what alerts parents to say, hey, what is going on here? It could be a delayed or absence ability to speak. And another thing too with communication is play. How do kids play? Spontaneous make-believe play or imitation is a characteristic feature of autism. Children with this spectrum disorder, may line up an exact number of things in the same manner, without awareness of what the toys are, what they are. So this is the type of behavior that you might see. The third hallmark of this is repetitive behaviors. May have preoccupations with things like spinning objects, shiny surfaces, lights, odor, sniffing, that type of behavior. Older children may be preoccupied with things like weather and dates and schedules and phone numbers, license plates. And you would typically see like ritualistic behaviors, doing the same thing every time. And this is just kind of a snapshot. This is kind of just of a slice of some of the behaviors that kids on the spectrum may have. When do they typically get diagnosed? What age? That is also very variable on the spectrum. Some kids get diagnosed earlier in life. Some kids get diagnosed a little bit later in life, an older childhood or even adolescence. That's why it's very, very confusing to people, and not only parents, but professionals too. Even people like myself, a physician. It's very, very, it's very confusing, and it's very frustrating to try to figure out what's going on. Because there's a lot of things to keep in mind when you're dealing with these kids. And I think that's all I want to mention about that. Now, there is a, let's see. Yeah, and just to kind of break it down. Typical behavior: avoiding eye contact, repeating actions over and over again, having trouble adapting, transitioning, having unusual reactions to the way things smell or taste or feel. These are the things that these kids have. Repeating or echoing words or phrases that are said to them. So those are the things to really keep in mind.